One of the most critical challenges that are faced in this space is really the comfort level of physicians in delivering a diagnosis, and the lack of training in how to provide a comfortable space, how to be comfortable with themselves, how well do they understand their own kind of perceptions around death and dying and comfort with that, and really how well they're prepared to understand where the patient is coming from, how they're prepared to get this diagnosis, what information do they have, how their family has engaged with them, what the caregiver understands about a potential diagnosis. So it's really a constellation of things that are clearly missing, or at least gaps in a lot of our medical education across the world. So there are many key factors for how healthcare providers can best deliver news. Our entire protocol really goes through a number of steps, beginning with advanced preparation. And that advanced preparation is both preparing themselves for what the patient and caregiver may know prior to the meeting, what they might be bringing to the meeting, any kind of previous research, any perceptions that they might have. It also is advanced preparation on how they are personally prepared. How well are they kind of versed in their own perception of death and dying? We term that know thyself. Do they know thyself, and how do they bring that into the diagnostic situation? Other steps include making sure that the space is comfortable, that you're not delivering a diagnosis in a hallway, in a busy setting where other people might be present. And finally, there is a tremendous amount of knowledge that needs to go into it. Not what knowledge does that healthcare provider have about the disease itself? What knowledge do they have about next steps? Because there are emotions that arise, there are questions that arise, and those patients in that family are going to ask, what's happening next? What should I need to be prepared for? And so that very specific knowledge is important for the healthcare provider. So the ALS SPIKES protocol is about advanced preparation, the location, the strategy, how you go about delivering it, what information you're actually delivering, making sure that you're being very clear about what it is that you're telling the patient and family member, the knowledge. Again, that empathy and emotion, which is part of that protocol, which I mentioned very briefly, is incredibly important. And being prepared to listen in silence, being prepared to hear and sit with that emotion and come with an empathetic response, which is a real skill. It's not something that everybody necessarily has. So all of these things are part of that ALS SPIKES protocol. There's a lot of different ways that you could go about learning this outside of our workshop, but really one of the reasons why we created this workshop and why we try to deliver it as many places literally around the world is to help people understand there are so many important key points and key places where healthcare providers can integrate some of these protocol pieces. And so we are working with different healthcare settings. We're working with different schools to integrate this kind of information into earlier medical practice. But a lot of it comes with asking questions of mentors, looking up best care practices. All of our materials are housed on the website of the ALS and M&D Alliance, which is the international alliance of organizations around the world that provide support for ALS M&D organizations, families, and communities.